So, Team Clarinet, can you please confirm whether we can start?
Yes, sir. So we are starting with the session now. So good evening and a warm welcome to everyone. This is Rituparna, the assigned moderator from Clarinet. Clarinet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Clarinet serves as a digital partner for this online event hosted by the InnovoCare e-Academy, and the focus of today's session is Arts of Microteaching in Postgraduate Medical Curriculum. Now, without wasting any further minute, let's begin today's session, for which I would like to invite our MOC, Dr. Shambhu Samrat Samazdar sir, the independent clinical pharmacologist and a renowned consultant. So he is also one of the leading diabetes and allergy asthma therapeutic specialists in Kolkata, to start the event today with his enlightening words and for the further coordination. So that is all yours, sir. Please proceed.
Thank you, Team Clarinet, for giving us this wonderful platform to host delegates in this very important meeting. And on behalf of InnovoCare e-Academy, which is a branch or non-profit organization from the InnovoCare Health Hub Solution, who are our technical partner. So I welcome you all in this national webinar. So we know this topic is very important for us, for the would-be teachers, and also the postgraduate students, especially because in their postgraduate final examination also, for the examination purpose, this is also a very important session. This is one of the important questions that need to be faced during the practical examination across discipline. So today we are delighted to have with us Professor Nirmala Rege, Madam. Madam was head at the Department of Pharmacology at St. George's Medical College and KM Hospital, Mumbai. Madam needs no introduction because she is a distinguished faculty amongst this medical education system in India. And Madam had done his MD in pharmacology, then DNB in clinical pharmacology. So we welcome you, Madam. And also today with us, we have one of the pioneers in clinical pharmacology in India, Professor Santanu Tripathi, sir. Sir was formerly head at the Department of Clinical Pharmacology at School of Tropical Medicine. Currently, sir is principal at the JIMSH Hospital and Medical College in West Bengal. So we are really privileged to have with us Professor Santanu Tripathi. Sir also needs no introduction. Sir had done his MD in pharmacology, followed by DM in clinical pharmacology. Sir currently is also the president of Clinical Pharmacologist Association of India. So welcome, sir. So with that, may I now request our chairperson, Professor Nirmala Rege, Madam, to have her introductory comments, and then we'll start today's academic session. Welcome, Madam.
Yeah, thank you. Thank you, Dr. Shambhu, for inviting me and asking me to chair. I'm also eager to listen to Dr. Shantanu. And as you rightly said, it is a very, very important topic for postgraduates. Mainly, this micro teaching deals with teaching trainers, teaching skills. And as you know, when we are doctors, we are also teachers, and even if we are not so uh, appointed as the faculty in a college, for all our patients we do the job of teaching, and therefore certain skills are required by us, uh, uh, and these teaching skills can be learned in a better way by this particular technique. And for pharmacologists, because I suppose that most of the postgraduate students here will be from pharmacology discipline, teaching is one of the important uh, avenue for all of us. And we do require these teaching skills. And therefore, this topic is very important to us, and we should know the techniques and how we can inculcate these teaching skills. With this, I request Dr. Shantanu to please start his session.
Good evening, everybody. And at the outset, I must thank Dr. Shambhu Somrat Somasdar for giving me this opportunity. And I'm really fortunate to have Professor Nirmala Rege, who is a doyen in medical education and technology in the country. And for her dedication, she is very well known and endeared by the students of medical sciences, learners of medical sciences throughout the country and beyond. So I'm happy that she is present today amongst us. So far as I am concerned, this is again, today's session is also not a macro session. It's a relatively small deliberation on my part. And then I hope there will be opportunity for interaction and further discussion on this matter. The topic is micro teaching, and the audience is, as I am told, that mostly postgraduate residents from different parts of this country. Now, micro teaching, the very word, it has two parts. Micro, we know micro means small, and teaching. Since childhood, we know what teaching is. Whatever we have learned, teachers have helped us, assisted us, guided us. So teaching is for learning. So any learning encounter, we always look back to our teacher. But then again, I must say that we only have few formal teachers, but otherwise we learn so many things in life. And for that, we learn from each other, we learn from others, we learn from parents, we learn from mother. The first teacher in our life is our mother. We learn from the nature. We learn from everybody around us. But then when you talk of formal teaching and formal learning, like as we today, most of us, all of us are listening, we are postgraduate trainees. So we have our own specialty where for a period of say 3 years in India, postgraduate training is for 3 years. So there is a curriculum and we are supposed to actually go through that curriculum. And there are also formal teaching learning sessions. We have our teachers there also. But then again, many of us, only a few of us who are training today will become formal teachers, will be placed at medical colleges, and apart from other professional responsibilities, they will also be expected to play the role of medical teachers. But then practically speaking, all doctors, as Dr. Uh, Nirmala has rightly pointed out, every doctor is basically a teacher. And the name teaching has also come from the word doctrine. Okay. And so those of us who will ultimately not become a formal teacher in a medical college, even then we need to know the teaching skills, because as a practicing doctor also, our role would be also teaching our patients, teaching our peers,
Sorry to
teaching
interrupt
our...
you, sir.
Yes, please.
But your slides are not moving yet, sir.
No, I have not moved this slide yet.
Okay,
Okay.
sir.
So, so that way, we cannot really escape learning. As we know, when we are in medical colleges, in undergraduate or in postgraduate, we try to learn a curriculum, but beyond that also, when we enter into our professional practice, our learning doesn't stop. In fact, we are expected to keep on learning throughout our whole career, whole life, in fact. So we are actually lifelong learners in this professional practice. So, but at the same time, we need to also play the role of teachers, even if we are not formal teachers. So thereby, for each of us, this subject or the topic of micro teaching is important. So I don't have too many slides really, but we try to understand what micro teaching is, because my experience has been many a times we find in the final examination, we find these residents, when they appear in the final examination, usually there is a session on micro teaching demonstration, and there we find they do not have a very clear idea of what micro teaching is. So that way also it is important to understand what it is in principle and how it can be practiced, how does it help, what is its significance. Let's move to the slides. So this slide shows that micro teaching what and why. Teachers are indispensable in learning and for learning. We all agree with this. And for teaching a topic, a teacher would need two things simply. One, a thorough knowledge about the topic, that means the content, and the teaching skills, specific teaching skills. The teaching should not be a trial and error method. That means one should have the teaching skills, or one should be confident about his role as a teacher, and then he should dare to be engaged in teaching a particular session. A teacher should have enough practice teaching prior to engaging in any real teaching. And micro teaching actually offers the opportunity for practice teaching through a mock drill, okay, through a simulation, in fact. So that is what is micro teaching. It is a practice session, rather practice teaching session. Let's understand a little further. There are different ways one can try to define micro teaching. Some people would say that it is a teacher training and faculty development technique. Micro teaching is a teacher training technique or a faculty development technique. A teacher, in this technique, a teacher reviews a recording of a teaching session in order to get constructive feedback from peers and or students. So according to this, it is expected the teacher will have a teaching session which will be pre-recorded, and then this record will be done whereby there will be other people who would be providing constructive feedback, and the teacher will try to accept those feedbacks and accordingly redesign the teaching and try to engage in another teaching session whereby based on this feedback, the teacher will try to modify or modulate himself in his and try to improve upon his teaching skills. The feedback is about what has worked and what improvements can be made to a teaching skill. So that is that the feedback should be centering around that. So accordingly, the people who are expected to give the feedback, the peers or the students, they should be properly sensitized towards that, what I am expecting from them. So they need to be sensitized. So the teacher practitioner or the teacher student should prepare himself, prepare the plan, and appropriately sensitize the peers or the students who will provide the feedback. People have also defined microteaching as an effective practice-based learning opportunity. So to learn how to teach through practice, that is what microteaching is. And this is done in a simulated setting. Okay, instead of a real setting, it's a simulated setting. And this can be used at any point in a teacher education program. Microteaching is also defined as a system of controlled practices that focus on specific teaching behaviors. We'll talk about the specific teaching behaviors. There are different teaching skills, but then you have to identify one skill at a time and try to improve that skill. And that focus on practicing those teaching behaviors under specific bounded conditions possible. So in a specific bounded condition, the teacher will try to demonstrate his teaching skill, a given teaching skill, in a small session. That is what is micro-teaching. And then getting feedback, and based on this feedback, we'll try to do it again, redo, and try to see whether he has been able to improve upon it. And this will be, he will continue to do this multiple times until and unless he is satisfied, or the peers or the assessors, they are satisfied with the achievement of the skill. So it is an effective PLO. So what is PLO? Practice-based learning opportunity for training and assessing teacher candidates and practicing teachers on specific teaching skill practice. Microteaching provides the scope for planning, implementing, analyzing instructional behaviors, and revising the same, means revising the same instructional behavior repeatedly until an acceptable level of performance is achieved. That is what is microteaching. So it is an opportunity for planning a session, implementing a teaching session, and then to be able to analyze instructional behavior or analyze the particular teaching skill on the basis of, based on the feedback that is received from the assessors, the peers or the students, and then revising the same repeatedly until an acceptable level of performance is achieved. I hope I have clarified it enough. Now this gentleman actually, for the first time, he came up with this idea of microteaching. That was in 1963. Dwight W. Allen in Stanford University. He said microteaching is a scaled down teaching encounter in class size and class time. So it is a small size audience or small size student group or peer group, or rather you can say the assessor group. And so far as the time is concerned, it is a less time, small time. And otherwise also it is a scaled down atmosphere or a scaled down encounter, teaching encounter. And that's why it is called micro. So why micro? So all are small here. Less time, small audience size, one skill at a time, and low risk environment. It is a simulated controlled environment. It's not the real one. So you are also reducing the anxiety of the teacher. A new teacher, his anxiety is reduced. So that's why it is micro. Less time. Usually the time is not more than say 5-7 minutes, maximum 10 minutes. Small audience size. Usually it is 5 to 6 people. One skill at a time. So that is, it is better not to try to master too many skills in one go. One skill at a time. Now we'll talk about these skills, teaching skills, and in a low risk environment where the anxiety level could be reduced in a simulated controlled setting. Now the objectives of micro teaching have been enlisted here. First, to give practice teaching to the teachers under training by lessening the complexities of classroom situations. Second, identify the drawbacks of the teacher, or rather poor skills, inadequate skills, and to give immediate feedback for modifying their behavior. Developing experimental teacher education programs and to encourage research identifying new teaching skills. So that is also one of the objectives of micro teaching. So in teacher training centers or teacher training endeavors, micro teaching is also used to trainee teachers, okay, for facilitating skill development among trainee teachers. This also one of other objective is to improve teachers through more control of instructional process and supervision. So when you talk of supervision, there is also scope for a role of a mentor teacher also. So among the peers, okay, the 4 or 5 people, they could be of average kind of intelligence or average kind of background, educational background. Okay, they are almost representing the average students to whom finally the teacher will be teaching, okay, in the real situation. But then at the same time, there could be a mentor teacher also who will give his final opinion about whether the teacher is deficient in the skill and to what extent he is deficient, and then under the supervision and guidance of the mentor teacher, the teacher can try to excel on his own skills, particular teaching skill. Next is to enable the teachers to gain confidence in teaching and master the teaching skills. Next, to utilize the academic potential of teacher trainers for providing the much needed feedback. And finally, to gain maximum advantage with little time, money, and material. So resources, less resource, that's why micro. So far as time, so far as money, material, so all are required less amount. Now coming to, I'll be broadly touching upon the 3 major areas of in a learning system, or 3 rather learning methods that are used in teaching learning. That is the didactic lectures, that is for hands-on skills development, the practicals or the clinical teaching, and the third is about group activity or group dynamics. And many of us who are conversant with the NMC, National Medical Commission prescribed new curriculum, competency-based curriculum, we have also noted that these are the 3 teaching learning methods that are used, okay, for imparting training to the undergraduates or even the postgraduates. Okay. Now, when you talk of a lecture, delivering a lecture, there also the kind of teaching skills that are involved in while delivering a lecture is somewhat like this. I cannot say this is a complete list, okay, or a very ideal list, but more or less this is we have tried to capture most of the critical skills that are required in order to deliver a good lecture. One is lesson planning, then presentation and explanation. How the teacher is presenting the content and how he is explaining. Illustration with examples is another skill. Reinforcement, repeating and reinforcing is another skill. Stimulus variations, how you are changing the stimuli. Okay, so thereby you are actually trying to draw attention. So people are at different attention levels. So by by cracking a joke or by giving narrating a story. So you are trying to convert their attention, and then again you come back to your okay uh, relevant content. So stimulus variation is also another strategy and another skill that a good teacher should have in a didactic lecture. Probing questions, okay, that also would make the learners attentive, and how to what extent they are able to uh, comprehend and receive, okay, and so that by probing questions also you can engage them, you can make it more interactive. So a good lecture is also one that has the opportunity for probing questions. Next is classroom management is also another skill that a teacher should have, particularly these days in undergraduates also we find there are gradually number of students are increasing, okay, 200 to 50 students in a batch in a lecture class. So classroom management is also important. Use of audiovisual skills, audiovisual aids, okay. uh, that is again these days we have been too dependent on these audiovisual aids, but then optimum use or appropriate use of audiovisual aids is also extremely important, okay. Blackboard writing still retains its importance, whether it is blackboard or a whiteboard. So that is again possibly is taking a backseat, but there is always an importance of using blackboard or whiteboard, okay, in traditional uh, delivery of lecture. And finally, the achieving a closure, how to close a session. So that is also one should try to learn, okay, how best we can close a session, end the lecture. So these are the different teaching skills. There might be a few more, like when we are starting a particular lecture, how to set induction, how you are introducing, okay, how you are calling everybody's attention. So all these are there. So not necessarily particularly a young teacher, okay, novice teacher, when he is asked to take a lecture. So maybe in his early stage, early career teacher, they might not be very confident. So micro teaching can really help them to make confident and a confident in their delivery of their lecture in reference to mastering of the different teaching skills. Now, group dynamics has a very important role in any professional curricular teaching learning, even in the CBME curriculum, competency-based medical education curriculum, whether it is for the undergraduate or it is for the postgraduates, group activity and group dynamics have been given a lot of emphasis, and very rightly so, because as doctors we are supposed to actually solve problems, health problems, and as doctor when we practice, we cannot practice in silo. So we always work in a team or in a group. There are many other players in our team. There is a nurse, there is a lab attendant, there is a office staff, there are colleagues, peers. So all of them, we are actually taking help from all of them. So we need to know how to interact in a group, how to lead in a group. Okay. So this skill will develop only when we are, okay, during our training, we are sensitized to working in a group through this group dynamics activity. The principles of group dynamics are principles of perception, principle of belongingness in a group, principle of change, principle of conformity, okay, principle of power, principle of common motives, that of readjustment, that of continuous process principle, and goal orientation. This presentation, we do not have any scope for discussing all these principles. That is not the purpose really. But I'm trying to emphasize is the skills in a lecture class and skills of a teacher in a group activity, okay, is different, clearly different. Okay. What a teacher is expected to do when the students are made to sit in a group of 7 or 8 or 8 to 10, and then given a problem to be solved through interaction among each other in that group. Now, what the teacher is supposed to do in that group activity. So there are the skills that the teacher would require to play his role as a teacher and facilitating a group activity or a group dynamic session. They are absolutely different. We'll try to know what are those skills. Now, this is how a group activity takes place. This the group dynamics at the center. You see the group dynamics theory support at the center, and then this the members of the group are expected to follow certain rules, norming. Then they are expected to perform certain things. They are expected to reframe. Okay, the group forming, group norming means there are certain rules in the group. There are storming means brainstorming. They will be deliberating on a given problem, given issue, and then they are expected to perform a given task, that is problem solving. So that's how, and they can necessarily do a reframing of the problem or reframing their own activity, etc. So these are some of the activities or some of the competencies they are supposed to actually master through group activity. And then the teacher's role is actually the teacher students thinking and learning strategies are to be considered, the effective teamwork, ensuring a safe and simulating environment. The teacher is supposed to ensure that. The teacher is supposed to provide an efficient lesson organization. Okay, teacher is supposed to assess if there are doubts. The teacher is supposed to clear those doubts. So all these are developing the knowledge and skills that the teacher will facilitate, catalyze the process of that. Okay, so the teacher will have rather a facilitating role here. Okay, not like what he does in a lecture class. So the teacher should be a keen observer. Okay, critically observing each member of the group, what they are doing. And as a general rule, in a group of say 8 or 10, there will be 1 or 2 who are taking a lead, and there will always be 2 or 3 who are shy and who feel inhibited, not engaging themselves into active interactions. The teacher has the role to actually facilitate, provide the confidence in those who are inhibited and motivate them and engage them into active discussion, and so that they develop, ultimately all the members of the team develop, okay, the necessary competence for working in a team. Now, these are the relevant teaching skills of a teacher in a group dynamic session. The teacher initially should be planning and pooling resources for having a good and effective group dynamics activity. The teacher should be able to provide appropriate guidance to each member. The teacher is expected to catalyze the emotional and social ambience for a group dynamic session. The teacher should be able to improve group relations within group relations, facilitating interactions among the members of the group. The teacher should motivate the inhibited members. The teacher should have a critical observation skill. The teacher should be offering appropriate cues and prompts as necessary. The teacher might also have probing questions in order to facilitate interactions in the group. And finally, the teacher will be guiding collaborative reflection. Okay, and to come to kind of a how to conclude, how to come to a consensus, so all this. So clearly, these skills are very different from the skills of what the teacher is supposed to demonstrate in a didactic lecture. Unfortunately, we are not really trained in this. Okay, we are, as soon as we enter in a medical college, we are asked to take a group activity session or go for taking a practical class, or we go for teaching the clinical skills to students. but then we do not have the necessary training to do that better. So if this is so, then how we can, as a teacher, we can actually master these different skills. Micro-teaching has a great role here, and we can, as a novice teacher, as a new teacher, we can take up one after the another skill and take a small session, micro-teaching session, where we can try to hone that skill with the help of the peers who are sensitized and who are requested to listen to or to watch and then give their feedback how the teacher is performing in a group activity session or group dynamic session. Okay, but for that you have to have a mock group activity session, or maybe sometimes in a real session, but that's not micro teaching. In a micro teaching, it has to be a simulated session, okay, where you can also repeat this again and again. Now coming to the third types of role, and that is in a practical class or in a clinical bedside class, patient bedside class, that is practical skills or clinical skills. Now teaching practical skills requires using very precise instructions to enable the learner to follow the process and to repeat the skill. And many a times this involves using both visual cues and text or audio prompts. These should be cues rather, not clues. Visual cues and text or audio prompts. It certainly requires special skills in an instructor if there are no visuals. Now these skills are to be identified and mastered. For distance learners, like these days we have been more used, thanks to COVID, more used to these e-sessions or online sessions, like this one is also happening. The most frequently used method for teaching practical skill is using print-based illustrations of step-by-step procedures. Okay. So these are all in practical skills. Now in clinical skills training, teaching clinical skills, we actually follow these ground rules that observe, record, tabulate, communicate. Use your 5 senses: learning to see, learning to hear, learning to feel, learning to smell, and know that by practice alone we can become an expert. So this was what Sir William Osler had said, who is considered as the father of medicine, clinical medicine. So this is what he had said about teaching clinical skills. So we all know skills of teaching some practicals. Okay, the 4-stage approach. Okay, these are, as we know, DOAP: demonstrate, observe, assist, and perform. So these are the 4 stages in practical skill sessions. And the role of the teacher, what should be the role of the teacher there? Stage 1 is the teacher will demonstrate the skill of at normal speed with little or no explanation. Say for instance, the teacher, a surgeon who is actually making a suturing. He has completed the surgery. Now he is suturing, whether it is suturing in a deeper suturing, okay, in a viscera, or whether he is suturing in the skin. Now that time he is actually not explaining, but he is doing at a normal speed in a real situation. Okay, and the student is to just observe. Okay, demonstration. Stage 2 is repetition of the skill with full explanation at a slower pace, encouraging the learner to ask questions. So this is the stage 2. So first is demonstrate. There also the student is observing, learner is observing, but the second stage, it is actually more emphasis on given on observation, and while his attention is also drawn to the explanation. So the teacher is here, the teacher is just doing the job and the student is watching. But the next is teacher is doing again, repeating, and at a slower pace, and also explaining, and the student is observing clearly. So first is demonstration, second is That is the role of the teacher. Second is observation by the student, by the learner. Third is the demonstrator performs the skill for a third time with the learner providing the explanation of each step. Now the learner is providing explanation and being questioned on key issues. The demonstrator provides necessary corrections. This step may need to be repeated several times until the demonstrator is satisfied that the learner fully understand the skill. And at this stage, the demonstrator can also, okay, encourage the student or the learner to assist him. Okay, by assisting, the learner will learn better. Even for suturing, he will also lay his hands. Particularly in learning surgical skill, there is no alternative than to go by this DOAP. Okay, and that is also true for different procedural skill, that is also across the different disciplines, clinical disciplines, as well as the laboratory disciplines. Okay, so at the fourth is the learner now carries out the skill under close supervision, describing each step before it is taken, so performing. So this DOAP, this also matches with this DOAP, the four stage approach in skills of teaching some particular skills. Okay, so here you see that ability to demonstrate the steps of a given procedure, allowing the observer to observe as well as listen to the explanations given by the demonstrator. Third stage is repeating and allowing the observer or the learner to assist. And then the fourth stage is allowing the learner to perform under supervision, under guidance. And then if this is repeated, and then gradually the learner would feel confident to do it all by himself independently. Okay, but then this whole thing, it is better to do it in a mock situation, simulated setting, rather than in real situation, because there is always a risk of, okay, at the cost of the patient himself. We cannot, many skills we cannot afford to learn by that, because there are ethical issues and there are higher risk to the patient. Okay, so gradually we are getting more used to using mannequins and other simulated setting, where we are trying to hone our practical skills and clinical skills. Okay, whether it is ability to palpate a liver, or whether it is doing a suturing, or giving an intravenous injection, etc. So here you see the expectation from a teacher, or the skills of a teacher, okay, are very different. And such skills, before actually getting into the real training of the real students, so the teacher can also think of getting engaged into micro teaching session, whereby each of these skills he can master, okay, by repetition, and on the basis of the feedback received from the evaluator and also guidance by the mentor teacher. So the micro teaching skill is actually involves planning, then teaching, then getting feedback, then replan based on the feedback, then reteach, and then get again feedback. So continue this until the teacher is satisfied, or the mentor teacher is satisfied with the performance of the student teacher. So this is how the cycle continues. A 36-minute micro teaching cycle, wherein teaching takes 6 minutes, feedback another 6 minutes, next 6 minutes, replan is 12 minutes, reteach is 6 minutes, refeedback takes 6 minutes. So this makes the cycle complete. That's how the micro teaching cycle goes. So it is important for postgraduate trainees to be conversant with this micro teaching cycle, and also to practice this micro teaching cycle, whether or not they have the love for becoming a teacher, love for teaching as such, and trying to be a teacher. Even today, being a teacher is rather not by choice, but rather by default. So you become, you do your post graduation, or super specialty, and then you land up in a medical college and then come into your teaching profession. So you become tutor or demonstrator, then you become assistant professor or senior resident, then assistant professor, then associate professor, and then professor. And then you are expected to actually guide students, teach students, making students learn or making junior doctors learn the skills. So whether or not some of us are going to become formal teachers, all of us, all doctors need to also know and understand and master the skills of teaching so that we can actually perform, do justice to our role as a doctor, as a practicing doctor also, or a laboratory physician also, lay our role to the desired level, to the expected level. I think that was the last slide. Thank you very much. Over.
Thank you, Dr. Shantanu. And should we ask the audience if they have any questions?
Yes, I think we can.
Yeah. So
I think the Dr. Shambho, can you tell us who, if there are questions in the chat box, or you can encourage them to also ask question directly?
yeah. There is one question by Smita Das. My query is, what is the difference between micro-teaching and pedagogy?
Pedagogy is a more generic term. In fact,
Yes.
I don't know whether you have noted, pedagogy starts with the word PED. What are the other words in medicine that starts with PED? One is pediatrics. The other, although it is not starting with, but then it also paid is there, and that is orthopedics. You know what is the meaning of orthopedics? How it came? The discipline came up basically to because it was involved in making a bent child straight. Bent child straight means there is structural deformity, and by surgery, bone surgery, people used to make it straight. So pedagogy, I'm sorry, so orthopedics. Ortho means straight, orthopedics. And then pediatrics. Pediatrics is the science of children's health. Now, pedagogy is the teaching learning technique or the educational science, particularly the teaching learning techniques that involves children, young children. That means Montessori teaching, primary teaching. So there actually this pedagogy applies best. Okay, that is from there the word pedagogy started. So anything relating to developing teaching skills, this broadly that refers to pedagogy. But then when you talk of micro teaching, it is a very specific teacher training technique, you can say. Okay, pedagogy is the pedagogy can be defined as the science of being a teacher, the science involved in making somebody a teacher, or the different teaching skills, relating to the different teaching skills. So that is a broad concept of making a teacher, pedagogy. Okay, or we can say pedagogic skills means all relating to teaching skills in simple terms. But when you talk of micro teaching, it refers to a very specific kind of technique whereby you are trying to improve on teaching skills, and that too, as I have stated, why it is micro, one teaching skill at a time, involving less time, only 10 minutes, involving a small audience size or people who would be providing you feedback, again 8 to 10 people at the most, and then making a low risk situation, low risk setting, not in the real class. So that's how one can try to learn better. I think you got the message. Thank you.
Yes. She has another question as well, and that was how the postgraduate should be evaluated on micro teaching in final examination.
I have a very critical comment on this. Unfortunately, most of the centers where I have visited as an examiner, I have seen that the concept of microteaching has really not been understood by the department itself. So many a times people make a mistake that microteaching means it's a small session, okay, a 10-minute session by which he has to make a presentation, and most of the time what they do, they take up a particular topic which otherwise, okay, should be requiring say not less than say 30 minutes or 40 minutes. They try to squeeze it in 5 minutes, okay, uh, and then they try to explain that with maximum emphasis on the content. Microteaching is not about delivery of a content very efficiently. Microteaching is about, okay, demonstration of the different teaching skills. So that's why I always have emphasized that while choosing a particular topic for a micro teaching session, it is always intelligent, okay, not to choose the topic from your own discipline. So if you are a surgeon, think of a topic from ophthalmology, or think of a topic from say, okay, physiology. If you are a gynecologist, think of a topic from ENT, something like that, which you are not, or maybe even outside the medical specialties. Think of a topic from philosophy. Think of a topic from geography. So where the audience, again, when you are choosing your assessors, they should also not be from your own discipline, because in that case their attention will also be, okay, focused towards the veracity of the content that you are presenting, okay, instead of their attention should be on your skills. So so if we know the purpose of a micro teaching demonstration by a postgraduate student in the final examination, what is the purpose of that, okay, as the examiner, then we'll be only assessing how he is demonstrating. He should know that there is a cycle and there is a recycle, okay, and there is a need for sensitization of the peers, whether they have mentioned that in the beginning, okay, and then whether getting the feedback at the end, and whether he is trying to analyze. It is called instructional analysis. Instructional analysis is a part and parcel of micro teaching session. So whether he is trying to do that, and then whether he is actually making an attempt to do a second session, so then only we'll know that he has understood the very principle or the concept of micro teaching, and he is trying to do that. But otherwise, even as an examiner, I have seen colleague examiners, they are also focused towards the content of the matter, okay, what he is presenting, and the discussion starts with that, okay. It is something like somebody talks of proton pump inhibitors, then people start talking on proton pump inhibitors and the content, okay, what are their indications, contraindications, etc. That's not the purpose of microteaching. I think I have explained. Thank you.
Yeah, actually, I want to add to that. That part in examination should not be called as a micro teaching, because that defeats the purpose when you say the micro. It is as a
Absolutely,
micro
I
teaching,
agree.
because
Yes.
micro teaching, yeah, because it is never in a stress-free environment. It is always a risk when you are presenting in the final examination. And when you select a topic, that topic selection is very, very important. Because actually the micro teaching, as sir said, it is only one skill at a time. But in examination, it is overall teaching skills are taken into consideration, and you have to keep that in mind. We can't change everything, and therefore you should have how you start, how you present, how you use the AV aids with what you are using, your slides, and how you summarize at the end. All these things are judged, and therefore the topic should be smaller so that you can finish it in 5 minutes. Suppose you are talking about a medical topic and not something different, then don't talk about diuretics as a topic. You may just put it as a adverse drug reaction to furosemide, something which is smaller, which you can finish in 5 minutes, and you can involve all these skills in it. That is the another way of looking at it. And I totally agree with sir that if it is a different topic than your own discipline, it is always better because uh, the content should not be evaluated. The purpose of micro teaching is not to assess the content. It is mainly to assess the teaching skills that one has to keep in mind. There is one question. How should we reduce the micro teaching to merely 8 minutes during examination? But I think now sir has told you that micro teaching per se is for 6 minutes or 7 minutes. So it is not something to reduce to 8 minutes. It is one skill you have to do, perform that. You have to practice that. In that 8 minutes time, you can in a micro teaching session, you can say that I want to do a good start, that is that set induction. And you can start it in a different way which you want. Suppose you want to start a topic like presenting a case, giving a story with some joke, whatever, whichever way you want to introduce that particular topic. And people will, with those who are present in that meeting, your peers or the teacher, they will assess you for that particular skill. So it is not difficult how to do it in 8 minutes. There are no for the ones. Micro teaching is a part of interview while selection of faculty. That is asked by Dr. Uma Gupta.
No, I think I think what you mean is probably while selection of a teaching faculty, the interviewer or the interview board might be interested to know whether you have adequate level of teaching skills you have attained. So for that, micro teaching may not be suited really. You may be asked to deliver a small talk for 3 minutes.
Yes.
Okay, so there itself they can evaluate. Okay, how are you doing?
Yes. There are no further questions. I would just like to say something related to this feedback. How to
Yes.
give feedback. Usually, it is a 2x2 technique which is used. That means you ask first the presenter that give 2 points that you liked in your presentation or for the skills which you have practiced just now, and give the 2 things where you could have done better. And same way, the people who are around you, there are usually not more than 5 or 6 people in that particular group, which is a micro group. So they will also tell that what are the 2 things which are good and what are the 2 things the person should have done better. And with this, what happens, that you are taking the commitment from the presenter when he self-assesses, and the others are also giving the comments for what is good and what is to be improved. And that the person can go back, think over it, not that each and everything one has to take a cognizance of, and each and everything you have to put it into practice, but make your own sense what is to be taken from that particular feedback, and then take action on that. So you again do that in that micro teaching cycle. You again practice that skill, taking into consideration the feedback which has been given to you, and see whether you are doing better now this time or not. That is one thing. And the second thing is about the video recording. Actually, it is a very good technique because you yourself can understand that what mistakes you are making. But sometimes people become very, very conscious when they understand that the video is taken, and therefore again the lot of talking to them or communicating with them why the purpose of taking the video has to be there. Otherwise, that technique can fail. Instead of that, with the peers, discussion with the peers may be a better way, if not video.
Actually, the logistic challenges of organizing a micro teaching session, as a solution to that, okay, to address that challenge, people have suggested that instead, if you can make a small video of your micro teaching session, and then at a suitable opportune moment, you can also get that video assessed by uh, some peers, maybe separately. You can send this instead of actual arranged micro teaching session. You record your 5-minute video and you mention that this is the specific teaching skill I need to excel, and what is your opinion in that. And
Correct.
then you send it to 5 people distantly, and they send back after looking at the video that these are the 2 good things and these are the 2 things that need to be improved this way. And then again, incorporating their advice, you try to modify and do it again for 5 minutes, like that. And apart from that, you can also self-evaluate once the video is done. So this is basically a, you can say, deviation from the conventional micro teaching concept. These are some of the um, modifications that have been suggested, that video recording and assessing that. And while assessing, it is also important that peers, then again people have said that whether the peers, the assessor peer should be from your own discipline or better is from different other discipline. Okay, so sometimes own discipline people, they will, again, as I have mentioned, that they may be more focused towards the content of these things rather than the, okay, your skill that you have identified. And the other comment I wanted to make is, if in a postgraduate examination I have to assess a trainee, okay, in the final examination, I would see first thing is whether he has identified a specific teaching skill, then whether he has come up prepared with a checklist and he is providing that checklist, assessment checklist, to the peers, and then whether he is receiving back those feedback forms and trying to analyze instructional analysis, and he is actually proposing to have another session based on that. If he does this, then I'll understand that he knows what is micro teaching, why it is, and how it should be conducted. If he doesn't, he directly goes and starts a PowerPoint presentation and ends it, then perhaps he doesn't know what a micro teaching is. He misconsiders that a micro teaching means a small teaching session, a small lecture. No, that's not micro teaching.
Correct. Correct. There is one comment with the NMC promoting the self-directed learning, how to. But that is a separate, I think,
Yeah,
talk should
exactly.
be there on the self-directed learning.
Right.
So we will leave that. There is someone who has asked that how do we take criticisms positively and improve ourselves,
What
because
is
that
that?
is a very,
Can you repeat, please?
yes, how to take criticisms positively and improve ourselves.
Right. Yeah, because the very purpose is that by design, I am ready to accept criticism positively, and that's why I am arranging a micro teaching session. So I should first have that attitude already, positive attitude. That's why I have been into micro teaching, that I am actually inviting positive criticism. So if I'm inviting positive criticism and I receive that, I should also take that positively. It's an attitudinal issue. So if I am otherwise practicing micro teaching for the purpose it is meant for, then I already have that positive attitude to accept the positive criticisms. That's it.
Correct. Because it is always starts from you, and unless you change your attitude, you can't say that I'm going to improve. And that is the first thing in the educational science. So one has to take the criticisms in a positive way, and when you are criticizing someone, there should be constructive criticism. It should not
Right.
be something uh, it's not you shouldn't pass a judgment on someone.
Right.
Make your feedback which is actionable for someone else, and
Right.
it should be on that particular behavior, that and it is always better, that's why, to start from yourself. what you did, like in your own presentation, and how to improve. So
So maybe that is the reason why probably it is also suggested that go for a low risk setting, and thereby they
Yes.
say it is always strategic not to consider your own colleague from your own department, try to assess yourself. So there is a possibility of jealousy, possibility of competitiveness, and there, although they might be giving constructive criticism, but then you may not take it in the right spirit. So that's why people say that avoid that kind of risk. Okay, don't go into that kind of risk. And if you are in pharmacology, try to get a peer from maybe some clinical discipline or this thing who doesn't have into any kind of competition with you, so far as your career is concerned, etc. And who are otherwise is unlikely to be unfriendly with you, something like that. So
yeah, one more criticism for micro teaching is that you practice one skill at a time, and that too with a small group, and that is also in that less risk environment. But when you go to the class, you have 150, 200 students in front of you, and it is not just one skill. You have to use plenty of many skills. And someone has said that a teacher requires as many as 50 skills. So how you will manage that in front of a class when you are, despite doing this micro teaching session?
yeah, micro teaching will only only provide you some degree of confidence and some degree of assistance, but it is not the be all and end all of teaching skills. Okay, so you should also, side by side, you should also have the necessary knowledge, necessary confidence, and but then first thing is, as a teacher, I should first be able to identify the specific skill which I believe that it is not up to the mark or it is not optimum. So that
Correct.
identifying that weak spot has to come from within myself, and then that's the reason why I am trying to take the help of micro teaching session to improve upon that particular skill. But micro teaching is not a substitute for my performance in the real world classroom. Okay, so that also
Yes,
gradually
but
through experience he will gain, and he will become
yeah, but
seasoned
as you right,
as a teacher. Yeah.
yes, but as you rightly said that it gives some confidence, and when
Yes.
it gives confidence, you start using the other skills as well. Uh, Miss, you yourself understand that okay how to go about it, and self assessment is always there, and taking feedback from the students is also there. So you keep on improving yourself.
The other comment is, in fact, whenever we talk of micro teaching, you only say the didactic presentations or the didactic lectures. All micro teaching discussion revolves around didactic lecture delivery skills. But then I think time has come when we have to apply micro teaching in role of a teacher or
Or
the skills of a teacher in practicals and group
as a
activities.
yeah,
Right.
that is as a facilitator.
Yes. Yes. Role as a facilitator.
Yes, very true. So, Dr. Shambhu, are there anyone wants to ask any question? They can unmute and ask. Otherwise, should we close?
Yeah, thank you, madam. Actually, there is no more question. We are following up in the chat box. So I think there is no more question. So we are really thankful to Professor Santanu Tripathi sir and Professor Nirmala Rege madam for your wonderful inputs. And I think this is one of the very important session and very less discussed topic for all of us. So we really appreciate both of your efforts to actually enlighten us. And I think I must remember the days when I was doing my MD in pharmacology. I got the opportunity to go for pharmatech. I think that is one of your brainchild, Madam Professor Nirmala Rege. So
Yes.
that is a perfect example how a teacher should act, and that 10 days compact program actually enlighten us what is actually pharmacology. What is pharmacology beyond any, I am not naming any specific textbook, but beyond that also there is something about pharmacology. First time we had learned it there. So once again, this is a golden opportunity for
Thank
me.
you so much.
Thank you, madam. And
Thank you so much.
and
I know
also,
it was a wonderful session, Dr. Shantanu. Even I learned.
yes, yes, and always we are blessed to have Professor Shantanu Tripathi, sir. I had that opportunity for last 8 years, almost, and 6 years as direct student of sir. So hopefully, sir will continue his blessing as my guru, as my teacher. So thank you once again, sir. And we all know how much your impact in teaching, and specifically when we were your student, we know how you give time to actually develop this micro teaching skills and in our departments. So thank you, sir. And I think in our tradition, the teachers are there, are in the topmost position of this society, and that is why our ancient textbook, they mention that Agyana Timirandhasya Gyananjana Shalakaya Chakshurun Militang Jena Tasmai Sri Gurave Namah. So we start our days chanting stotra to show our pranam to our gurus, our teachers. So micro teaching is that skill we need to acquire to become a good teacher. So thank you once again. And also we need to thank iNovocare E-Academy and our technical associate iNovocare Health Solution, who are also very much eagerly doing this teaching practice amongst not only amongst the healthcare professionals, but also to the patient and common people to increase the health literacy. And I think we should be very much thankful to their director, Mr. Rohan, for their continuous effort. And we have developed one very important device, that is MedPar, that is increasing the adherence amongst the elderly population. And we had conducted multiple awareness program on that particular device to actually promote the importance about medicine adherence. So again, thank you, iNovocare Health Solution, for giving us this opportunity to host this event. And finally, we need to thank Clarinet for giving us this digital platform to host this national webinar on micro teaching. Thank you, Professor Shantanu Tripathi, sir, Professor Nirmala Rege, madam, once again for giving us your valuable time. Thank you all.
Thank you.
So thank
Thank
you,
you.
doctors, for sharing your valuable insights. It was really an interactive session. I hope you had a seamless experience. So we are looking forward to host you again very soon in another interactive session in the near future. Till then, stay safe and healthy and take care. Good night to all.
Bye-bye.
Good night.
Thank
Good
you,
night.
everyone.